Why aren't people blaming Barack Obama? Promises that he made during the time I told you healthcare was going to get more expensive. The only way for costs to go down is for there to be more competition, not less. Less regulation, not more. Healthcare is one of the most, if not the most heavily regulated business in America. And when government is involved in paying 50% of healthcare costs, by definition, you're going to have inefficiencies. And the cost will be shifted over to the other half of the healthcare dollar that the private sector pays for. Here is Obama back in May 2009, number 41.
Everyone from union members to insurance companies, from doctors and hospitals to pharmaceutical companies. And it was a meeting that focused largely on one of the central challenges that we must confront as we seek to achieve comprehensive reform and lay a new foundation for our economy. And that is the spiraling cost of health care in this country. They're here because they recognize one clear, indisputable fact. When it comes to health care spending, we are on an unsustainable course that threatens the financial stability of families, businesses, and government itself. And this is not news to the American people, who over the last decade have seen their out-of-pocket expenses soar, health care costs rise, and premiums double at a rate 4 times faster than their wages. Today, half of all personal bankruptcies stem from medical expenses. And too many Americans are skipping that checkup they know they should get, or going without that prescription that would make them feel better, or finding some other way to scrimp and save on their health care expenses. What is a growing crisis for the American people is also becoming an untenable burden for American businesses. Rising health care costs are commanding more and more of the money that our companies could be using to innovate and to grow, making it harder for them to compete around the world. These costs are leading the small businesses that are responsible for half of all private sector jobs to drop coverage for their workers at an alarming rate. And finally, the explosion in health care costs has put our federal budget on a disastrous path. This is largely due to what we're spending on Medicare and Medicaid, entitlement programs whose costs are expected to continue climbing in the years ahead as baby boomers grow older and come to rely more and more on our health care system. That's why I've said repeatedly that getting health care costs under control is essential to reducing budget deficits, restoring fiscal discipline, and putting our economy on a path towards sustainable growth and shared prosperity.
So what does Obamacare do? Obamacare simply expanded the number of people eligible for government-paid-for health care. And you're shocked that costs have gone up and premiums have gone up? Don't you love it when Democrats who never run a hot dog stand tell other people that they make too much money and we're going to lower costs by waving a magic wand and doing this and doing that and doing this and doing that, and then you're shocked when it doesn't work? Oh, they were high-fiving each other after Obamacare passed. Remember when Joe Biden said it's a big effing deal on a hot mic? If you think health care is a right, and people are therefore entitled to it, and you can tell people in the healthcare business how to practice healthcare, you're going to be very surprised when quality goes down, accessibility is not there, and costs go up.